I'm a medical laboratory officer. I'm working with the USAID STAWISHA Pwani. Apart from that, I mostly support Moi County Referral Hospital, but also support all other facilities in Matters Lab. My title is the rejection rate reduction of viral load samples in Taita Taveta County. My co-authors were Mr. John Unyambu, who is here, the CMLC, then James Njogu, from STAWISHA. For us to achieve the 3095 of the UNAID target, viral load suppression among people living with HIV on ART is critically dependent on the integrity of the viral load sample. You find out that a high sample rejection rate will definitely compromise the quality of the results and even the service delivery. The nationally recommended rejection rate for VL, rather any other sample, is below 2%. This means that any rejection rate that is higher, rather elevated, will definitely pose a significant barrier to optimal HIV care. The objective was to reduce the viral load sample rejection rate across the 66 facilities in Taita Taveta County. The targeted key rejection causes were missing samples. We had hemolyzed samples, lab request form sample mismatch, then we have insufficient sample volume. On the methods, it was a retrospective study across the 66 facilities, as I said, that STAWISHA Pwani supported. These are, remember, these are the ART sites. Then the data were extracted from the NASCOP dashboard. That's the URL link to access the same. It can be accessed by anyone from us. And I use 10 months as the baseline. That's from January to October 2024. Then we had November 2024 to August 2025 as a post-intervention. Among the interventions, we employed on-job trainings, that's OJT, where we were roving to the facility, such as from Kishushe to Sangeroko, from Eldoro to Kasigau. We've been in the facilities. We also did a comprehensive staff training. We, as the lab department, by the help of USAID and the county CMLC, we were able to develop laboratory SOPs. We've distributed to a good number of facilities, but all the facilities are catered for. On the results, in baseline, we had 5,424 samples being collected for viral load. Then they were sent to CPGH. Out of the 5,400 samples, 424 samples, 95 samples were rejected. That posing a 1.7 rejection rate, 1.75 rejection rate. Then post-intervention, that's from November 2024 to August last month, we collected 4,935 samples, of which only 10 samples were rejected from the testing site, posing a 0.2% rejection rate. Allow me to talk about these that from last year, January to October, we posted 95 samples, but it was, there was a month when we had 25 rejected samples. That was on February 2024. Then from November to date, in November we had 3 rejected samples, December 5 rejected sample, January 1, February 1 rejected sample. From March to date, we've been recording 0 rejected rate for the VL samples. The graph shows the baseline in red. Then that's green, right? Hello, that's green. Green is the post-intervention where the rejection rate is 0.2. On our recommendation, We recommend the regular training of phlebotomists. By talking about phlebotomists, remember we have facilities that don't have lab techs. So we are really equipping clinicians, nurses, or whoever is handling their clients. Then we have our careful sample preparation before referral. We also know that some facilities were collecting samples, then they sent to the hub, rather to the testing site, then they were uncentrifuged. So once we spin those samples that have been placed in the below 20 degrees Celsius, they definitely hemolyze. Then we also recommend the annual training for sample transport riders. I understand we have 5 riders. Now we recommend that we'll have annual training for the same. Then consistent use of the laboratory SOPs. Upon rolling out the SOPs, we realized that we had that improvement now from that drastic drop to where we are now. Then we also advocate for implementation of facility remote logging of samples or a lab manifest. This will make us to avoid double entries, or you can find out that the sample has been entered into the system more than 2 times. Then finally, we also recommend now this to the county for the formation of integrated sample referral system committee, which will help now to sort everything from the healthcare workers to the riders to the spoke to the even the sites that are needed, the machines that are needed, the centrifuge and everything. We acknowledge now the USAID STAWISHA Pwani, who is my employer, the Department of Health Services, Taita Taveta County, medical laboratory technologists. I remember I've been pushing our lab techs from Moi, here they can concur with that. Then finally, the NASCOP. Here are some of the photos that we took when we were doing the OJT training. The first photo is the training. The second one is an OJT. It's in Undanyi. That is Nyache. Then this one is Sangeroko Dispensary. These are the SOPs that we print to the facilities. Asanteni sana.